HIV symptoms in men, early signs. Hello friends, this is Mark Medicals teaching you about HIV treatment, latest on HIV cure news, HIV tests, and all about how HIV is transmitted. In today's video, you will also learn more about the following. 1. How long does it take to show symptoms of HIV? 2. What are HIV AIDS signs and symptoms? 3. How can HIV AIDS affect your life? 4. How to reduce the risk of getting HIV. 5. How do you treat HIV symptoms? As a bonus, I will tell you when all HIV tests are conclusive towards the end of the video, so please, before asking any questions about HIV testing, watch the whole of this video. Alright, let us get started and answer those questions. 1. How long does it take to show symptoms of HIV? Guys, I have already answered this question so many times, but some of you still ask it on this channel. For the new visitors, HIV and AIDS are different. HIV is a virus, if left untreated, leads to AIDS. On the other hand, AIDS is nothing but a collection of infections that attacks your body once your immunity has been weakened by the virus. After exposure to HIV, like through unprotected intercourse, you will most likely experience early HIV symptoms in the first 1 to 2 months. Early HIV symptoms will last for 1 to 2 weeks. However, not every person infected with HIV will experience the symptoms. Actually, research has shown that only just more than 60% of you could experience the symptoms. 2. What are HIV AIDS signs and symptoms? A person living with HIV could at any time experience symptoms. HIV symptoms are different from AIDS signs and symptoms. A fever is one of the early signs or symptom of HIV infection and occurs alongside other flu-like symptoms. Other symptoms include fatigue and headache, because HIV needs a lot of energy to replicate in your body. This process consumes lots of your energy, leading to fatigue. Swollen lymph nodes and muscle pain. Lymph nodes filters bacteria, viruses, and other germs in your body. As a result of your HIV infection, you will have your lymph nodes enlarge after 1 to 2 weeks in response to the new immune response to HIV infection. HIV skin rash. HIV rash is also one of the signs and symptoms of early HIV infection. Early HIV infection triggers a severe immune response, which alongside low immunity results in an itchy HIV rash. Other early symptoms include nausea, vomiting and diarrhea, sore throat, and night sweats. Signs and symptoms of AIDS include severe infections like HIV-related cancers, HIV-related mental diseases, tuberculosis, skin infections including dermatitis or itchy prurigo, persistent diarrhea, persistent and unexplained fevers, progressive weight loss leading to wasting syndrome, herpes zoster, HIV-related brain disorders, severe chest infections, and so many others. One of the early HIV symptoms in men is reduced libido or erectile dysfunction. 3. How can HIV AIDS affect your life? HIV virus attacks and destroys cells of your immune system called CD4 cells. People who are not living with HIV should have CD4 cell counts of 600 to 1,500. If you are living with HIV and not taking any HIV medicine, your CD4 cell counts will slowly fall below 500. You will start feeling the effects of HIV once your CD4 cells fall below 500, and according to the World Health Organization, you will clinically be diagnosed with AIDS once your CD4 cell counts fall below 50. Untreated HIV usually progresses to the AIDS stage in 5 to 15 years, and what is bad news is that you will have less than 3 years to live if you develop AIDS. Opportunistic infections are diseases that usually trouble people living with HIV who are not taking antiretroviral therapy medications. 4. How to reduce the risk of getting HIV. Yes, you can reduce the risk of getting infected with HIV by doing the following. Using condoms offers more than 99% protection if used correctly. Abstinence and being faithful to one partner is a practice we have preached for centuries as a measure to reduce the risk of being infected. Using HIV PEP or HIV PrEP medications reduces the risk of getting infected by more than 90%. Also, studies have proved that circumcision reduces the risk of getting infected by 60%. This study confirmed the reason why HIV infections rates are very low in countries where circumcision is a norm. For instance, HIV rates are very low in Muslim Asian countries compared to other areas. So guys, Mark Medicals recommends circumcision of all sexually active men as a way of HIV prevention, in addition to other medical benefits of surgically removing your prepuce. 5. How do you treat HIV symptoms? HIV AIDS symptoms usually go away even without treatment. But if symptoms persist, you should visit your doctor for treatment, which should not be expensive. If you want to boost your body immunity as a way to stop those symptoms, see the health products links in the description section below this video. AIDS can only be treated using antiretroviral therapy. Currently, we do not have a complete HIV cure, though lots of companies like American Gene Technologies are steps closer to HIV functional cure. For time being, make sure you take your medications as told by your doctor. The good news today is that HIV-positive people have the same life expectancy just like people with no HIV. If you have undetectable HIV, the risks of infecting your loved ones are absolutely zero as long as you remain undetectable. Your HIV will be undetectable only by taking your HIV medication religiously. As a bonus, you guys keep on asking me the same questions concerning HIV testing. Here are a few points about HIV testing you need to know today. 1. The maximum HIV window period today is 90 days. The window period is not 6 months as it used to be before, because we have strong advanced HIV test kits today. 2. HIV RNA tests and 4th generation HIV tests are conclusive from 45 to 50 days after infection. 3. Antibody-only rapid HIV tests are conclusive after 90 days. 4. If an HIV test is conclusive, it means the highest accuracy and therefore you should not repeat the test. An example. According to UK guidelines, you should not test again if your result from a 4th generation test kit is negative after 45 days. 5. An HIV test that is conclusive, for example at 45 days, is also conclusive at any date after 45 days, e.g. 60 days, 80 days, 5 months, 5 years, etc. 6. There is no good research done to know the accuracy of HIV tests before 45 days or beyond 90 days. So, I will not have a good answer if you ask me about HIV accuracy before 6 weeks or beyond 90 days. 7. If you tested using HIV RNA tests or 4th generation HIV tests, then the window period is shorter at 45 to 50 days. Only rapid tests have the longest window period of up to 90 days. 8. Of all the tests, HIV RNA is the best test if you want to detect your HIV at the earliest stage, followed by 4th generation. Alright, hope the question, HIV symptoms in men early signs, has been well talked about. Do not miss our next videos, subscribe today.